In order to understand the history of abortions in America, we first have to discuss its origins. In colonial America, what we currently refer to as an abortion was not referred to as such. If a pregnancy was ended, it was viewed as promoting uterine bleeding or bringing on one's period. For example, in the 1855 book, Handbook of Domestic Medicine, the section Emmenagogues provided substances that provoked uterine bleeding and referred to it as promoting the monthly discharge from the uterus. It was common practice for women to use herbal remedies to terminate a pregnancy during this time. Medical literature and newspapers in the late 1700s and early 1800s regularly referred to herbs and medications as abortion-inducing methods, since surgical procedures were rare. The practice of abortion in the 1700s and 1800s didn't have any restricting laws and generally went unregulated, and was viewed as a regular part of women's lives. Common law allowed women to practice this onset of menstruation prior to quickening, which referred to a stage in pregnancy in which fetal movement could be detected by the mother. Abortions were regularly practiced by midwives, nurses, enslaved women, and other unlicensed healthcare providers. Men had virtually nothing to do with the practice of abortions before the Civil War. While abortions were common practice, that didn't prevent some groups from being excluded and marginalized. Although abortions were legal up until the Civil War, there were exclusionary rules put in place for enslaved black women that did not apply to their white counterparts. Since enslaved women were viewed as property of their owners, any children they conceived were also viewed as property. Enslaved women had no agency over their own bodies, so their owners prohibited them from receiving an abortion. The history of racism and misogyny surrounding abortion echoes in the laws and practices that would later be developed.
Now, when looking into how abortion came to be structured, it is first important to understand the concept of medicalization. Medicalization refers to the process in which conditions and behaviors are labeled and treated as medical issues. When looking at this through the lens of abortion, we are basically trying to analyze how abortion came to be a medical procedure. The first recorded event of an induced abortion is by Egyptian Ebers papyrus in 1550 BC. Although this was the first recorded event, it wasn't the type of abortion we think about today. This type of abortion was a non-surgical method that included inducing the patient into extreme physical stress and causing a miscarriage. Although now we know that these things don't necessarily lead to a miscarriage, this was an early world conceptualization of abortion. Abortions became widely practiced in the United States in the 17th century up until about 1880. During this time, midwives would come to people's homes and perform abortions using herbs and medications. Modern abortion is a little more complex, and it's hard to pinpoint exactly when it started. There's a majority consensus that says Iceland's Law 38, which states that a mother's health and domestic condition must be taken into consideration when deciding whether a doctor can or cannot perform abortion, led to the West's first major country to legalize abortion. In the US, there are two types of major abortions: the abortion pill or the surgical abortion. For the abortion pill, this involves taking two medications, mifepristol and misoprostol, to end a pregnancy. These medications cause cramping and bleeding to empty the uterus. A woman can take these pills 11 weeks after the first day of their last period. The other type of abortion, surgical abortion or in-clinic abortions, involve surgery. When you can get this type of abortion depends on a variety of factors, including state laws, type of doctor, and abortion clinic. It's usually very hard to find doctors or nurses who will perform an abortion after 12 weeks. There are a variety of methods used for the surgical abortion. These include aspirations and dilations and evacuations. These methods involve relaxing the cervix and using suction to empty out the uterus. In very rare cases, which include pregnancies after the 24th week period, doctors can induce labor or perform hysterectomies to have the abortion. These are extremely uncommon and are usually the last option resort and only happen if the fetus is providing harm to the mother or if it's deemed that the fetus won't survive the pregnancy. Now that we've identified the origins of abortion and how it has come to be a medical procedure, It's important that we consider the political factors that are impacting this medical procedure.
In 1847, the American Medical Association, composed of male doctors who lacked expertise in pregnancy and reproductive health, was formed. They scrutinized midwives, nurses, and reproductive health care workers. In an attempt to control this part of healthcare and take down midwives, they launched a criminalization campaign against abortion and female abortion providers. Laws to restrict abortion were put in place, and by the 1880s, every state had laws restricting abortion, with some exceptions in some states if abortion was needed to save the patient. By 1910, abortion was illegal in every state, only with exceptions in situations where abortion was needed to save the life of the patient. Only doctors had the power to make this decision, 95% of whom were men. During this time, immigration was increasing, and as a way to get upper-class white women to have more kids, white men in power supported abortion bans. In 1930, illegal underground abortion killed 2,700 women, about 1 in every 5 of the recorded maternal deaths that year. In 1955, Planned Parenthood held the first national conference on the issue of abortion, where doctors publicly called for abortion law reform. Greater support for law reform was gained in 1962 when a pregnant TV host had to travel to Sweden to receive an abortion after, in hopes of easing pregnancy symptoms, ingested thalidomide, a drug found to cause severe birth defects. In 1964, the Association for the Study of Abortion was registered by abortion law reform activists. In 1966, 9 well-respected doctors were sued in California for performing abortions on women who were exposed to rubella, known as the Trial of San Francisco 9. Doctors across the U.S. defended these 9 doctors, and this caused California to amend its law, allowing hospital committees to approve requests for abortion. This was one of the first abortion reform measures in the U.S. In 1969, the National Association for the Repeal of Abortion Laws was established in Chicago. Between 1967 and 1973, Alaska, Hawaii, New York, and Washington completely repealed their abortion bans, and 13 states enacted reforms that expanded exceptions. In 1970, New York became the first state to legalize abortion. In 1973 came the U.S. Supreme Court case Roe v. Wade.
In the U.S., it has been a long and bumpy road in terms of the politicalization of abortion and women gaining rights for abortion. It all started, the Roe versus Wade Supreme Court case was the case that legalized abortion in the United States in 1973. From there, safe legal abortion remained a constitutional right for almost 50 years. So that was a really big and important moment for the politicalization of abortion. However, from the start, Roe versus Wade was very flawed. It said that people had the right to abortion, but it never protected people's accessibility to abortion. This allowed lots of states to pass laws that made getting an abortion nearly impossible. And in 1976, the Hyde Amendment was a national policy that was widely viewed as racist policy, became a law. And for years, anti-abortion right politicians promised to appoint judges and justices hostile to abortion rights. These politicians used their power to manipulate these nomination rules, and now the Supreme Court is dominated by justices who are indeed hostile to abortion rights. On June 24th in 2022, the Supreme Court ruled in Dobbs versus Jackson's Women's Health Organization, which was a case involving a challenge to the Mississippi ban on abortion at 15 weeks of pregnancy. That ruling overturned Roe versus Wade and ended the federal constitutional right to women's abortions in the United States. As a result of this, 1 in 3 women in the U.S. now live in states where abortion is not accessible to them. In the first few months after Roe was overturned, 18 states banned or severely restricted access to abortion. Today, more states are working to pass these bans. The abortion bans that have taken effect since June of 2022 have inflicted harm on the Black, Latino, and Indigenous and other communities of color. These communities have all faced systematic racism and with long-term struggles to easy access to opportunities in healthcare, and now today they are still facing that with abortion. So overall, it really has been a journey for women to gain these abortion rights, and it has been periods of time where abortion has been accessible and legal by the constitutional law, and people have found their ways to work around it, and states have made their own decisions on whether or not abortion should be legal.
In 2323, abortion is a heavily debated conversation in society for reasons mainly associated with morality. Research shows that for many United States citizens, the morality of abortion is not black and white. There are those who find abortion both morally wrong and morally acceptable, dependent on the circumstances behind the abortion. Morality goes beyond the act of just getting an abortion, but also applies to the government and the legal status of abortions. Many Americans feel that abortion is morally wrong, but believe it should be legal and accessible. In today's world, the government and healthcare professionals are in charge of protecting women's rights, rather than granting that power to women themselves. Yet the government's actions are morally corrupted when it comes to women and their rights. This raises the question of if it is morally acceptable for the government to establish laws about women's health care and rights. Furthermore, there are many factors that influence the accessibility of abortion care, specifically social and political factors. Behind every abortion is lack of access to contraceptives, financial resources, and overall poor health care and sexual education. Not only does this highlight racial and ethnic disparities, it contributes to the reasoning for why abortion rates for Black and Hispanic women are higher than the abortion rates of white women. Corruption of the true nature of abortion has negative and disproportionate consequences for those of different races and ethnicities, and to those struggling with poverty and have lesser means. Roe v. Wade was the 1973 court case in which the Supreme Court recognized the constitutional right to obtain an abortion. In June of 2022, the Supreme Court case Dobbs v. Jackson Women's Health Organization ruled that the U.S. Constitution does not declare the right to an abortion, overturning Roe v. Wade. This allowed each state the ability to place their own laws on abortion. By 2023, 13 states had fully banned abortion, 5 states had placed restrictions on abortion, and 6 states had attempted to enforce laws restricting abortion, but had been blocked by judges. In only about half of the states, abortion was completely legal. This created limited and unequal access to abortion. Those who lived in a state with abortion bans had to travel to neighboring states to receive abortion care. Traveling to a state where abortion is legal to receive an abortion was not illegal even if you resided in a state where abortion was illegal. However, some states banned insurance from paying for abortions, and therefore even if someone seeking an abortion was able to travel to a neighboring state, they may not be able to afford to get one because of these restrictions. Also, most of the states that banned or placed restrictions on abortion bordered each other, another factor contributing to the difficulty in receiving an abortion if you lived in a red state, since people who lived in red states likely had to travel far if they wanted an abortion. The overturn of Roe v. Wade made getting an abortion less accessible, especially for those facing poverty. Before Roe was overturned, some states enacted trigger laws. This meant that immediately after the overturn, abortion became illegal in these states. Some of the states with abortion laws allowed abortion only in certain circumstances, while others banned abortion completely. Depending on the state, abortion was punishable by up to 10 years in prison or up to a $100,000 fine.